Hello, good afternoon to all. Today, in this lecture I am going to discuss about the Nipah virus in details. Several incidents of Nipah virus has been reported from various countries including India. People are panic and started comparing the Nipah virus infection with COVID-19 infection. Now, let's talk about the Nipah virus. Nipah virus is zoonotic virus, which means is transmitted from the direct or indirect contact with animals, primarily the wild fruit bats, flying foxes, and infected domestic animals like pigs. It can also be transmitted by via direct contact with the body fluids of the infected animals, such as saliva, blood, urine, and sweat of the infected animals, and even items like fruits and sap eaten by the animals. Now let's talk about the taxonomy of Nipah virus. Nipah virus belong to family Paramyxoviridae, genus Henipavirus, order Mononigaviriales. Let's talk about the origin of naming of this virus. Several people around the world might have think this is a new virus. But, in reality it is old virus which has been first identified and isolated in 1998 from a Malaysian village. Sungai Nipah. The Nipah infection is a viral disease with a high pathogenicity. At that period of time approximately 300 people has been severely infected, of which 100 has died. Since it has been first isolated and identified from a Malaysian village, Sungai Nipah, its name, Nipah, is actually the Malaysian village name in which the person infected from the virus was first isolated succumbed to the disease. Let's talk about morphology or structure of virus. You might be curious about the shape, size, and genomic structure of this virus. Hold on your breath, I am explaining all these one by one. Let's discuss about the where it is an enveloped virus or not. It is definitely the enveloped virus which possesses a several projection on the surface of envelope that is G spikes and F protein, of which G proteins which helps in attachment to host cells and F proteins which helps in entry to host cells and fusion of infected cell. Now, let's discuss about the shape. Nipah virus is pleomorphic virus with spherical or thread-like in shape. If we see about the size of virus, Nipah virus is approximately of 120 to 150 nanometers, nm, in diameter. Let's see about nucleic acid. Nipah virus nucleic acid is single-stranded unsegmented RNA virus with a genome size of approximately 18.2 kilobits with 6 structural genes, proteins. Nucleocapsid, N, phosphoprotein, P, matrix, M, fusion protein, F, glycoprotein, G, and RNA polymerase, L, and 3 non-structural proteins, namely the C, V, and W proteins. Now, let's discuss about the geographic distribution in endemic regions. Evidence which shows that presence of the virus in various regions across the globe. Since the 1990s, the outbreak of Nipah virus has been seen sporadically, mostly in the Southeastern Asia. An epidemiologic review published in 2019 demonstrated that there have been a total 639 Nipah virus victims had been reported from Malaysia, 265 cases, Bangladesh, 261 cases, India, 85 cases, Philippines, 17 cases, Singapore, 11 cases, with about greater mortality rate. Now, let's talk about the natural host of Nipah virus. Natural host of Nipah virus is fruit bats belonging to genus Pteropus. Now, let's talk about susceptible host of Nipah virus infection. Does the Nipah virus causes infection only the human and bat? Answer is no, it can causes the infection to various animals including pigs, dog, cat, goat, sheep, horse. So, you might caught infection when you comes in close contact with the Nipah virus infected animals. Now, let's discuss about the pathogenesis of Nipah virus. Nipah virus, NIV, pathogenesis involves initial infection of the respiratory tract, followed by systemic spread via the bloodstream, targeting endothelial cells, and causing severe vasculitis and encephalitis by disrupting the blood-brain barrier, BBB, and infecting neurons, leading to high fatality rates and potential neurological damage. Now, let's talk about the source of infection of Nipah virus. First source of infection is natural host reservoir, i.e. fruit bat belonging to genus Pteropus. Secondly, source of Nipah virus infection is fruits or fruits products contaminated with urine or saliva of infected fruit bats. Thirdly, the patients and their body secretions, respiratory secretions, and excretions. Fourthly, the Nipah virus infection source is infected animals and their body secretion, body fluid, and their meats. Nipah virus is contagious. It can be easily transmitted through bodily fluids like saliva, poop, pee, and blood of infected host or natural reservoir. Let's discuss how the human will acquire the Nipah virus infection. Most common mode of transmission of Nipah virus infection are: human may acquire the Nipah virus infection by consumption of fruits or drinks like fresh date palm sap contaminated with secretions, saliva, and excretions, droppings, of fruits, bats, and infected animals. Secondly, human may acquire Nipah virus infection by direct contact with infected domestic animals, pigs, sheep, cat, horse, and their body secretions, body fluids, such as blood, urine or saliva, and their excretions. Human-to-human Nipah virus infection transmission may occur due to direct contact with infected person or by the inhalations of respiratory droplets produced by Nipah virus infected persons during coughing, speaking and sneezing. Now let's talk about the pathogenesis in very details from entry of pathogen to human body. The Nipah virus may enter the human body through oral route or nasal route. In oral, Nipah virus enter the human body during to ingestion of fruits contaminated with fruits, bats, saliva. Meanwhile, in nasal route or Nipah virus may also get entry in human body through nasal route during the inhalation of respiratory secretion of Nipah virus infected person. Virus which they enters the human body, they attached to nasopharyngeal epithelial cell with the help of G protein attaches to ephrin B2, B3 receptors in respiratory which multiply in host cells and invade the blood vessels, enters to blood causing the primary viremia. Nipah virus along with blood reaches to brain crossing the blood-brain barrier, BBB, or through the olfactory nerve. Infection of brain tissue and damage of BBB leading release of distinct inflammatory cytokine like IL-6, IL-8, tumor necrosis factor alpha, TNF-alpha, granulocyte colony stimulating factor, GCSF, which ultimately leads to development of neurological signs. Now let's discuss about the distinct clinical manifestations seen during Nipah virus infection. Human with Nipah virus infection may or may not shows any symptoms. So infection with Nipah virus may be symptomatic or asymptomatic. Symptoms may be mild to severe. Usually, after the Nipah virus infection, patient starts to show the symptoms 4 to 14 days, but sometimes symptoms development in patient may take 45 days. Now let's talk what are the possible clinical symptoms that can be noticed in patients with a Nipah virus infection. Most common clinical manifestation are fever, headache, muscle pain, myalgia, nausea, vomiting, sore throat, coughing, respiratory discomfort, acute respiratory distress. Now let's talk about the several complications which can be seen in patients with severe Nipah virus infection. Most common complications seen in brain, lungs. We will discuss about the neurological and pulmonary complication of Nipah virus infection. Neurological complications such as severe acute encephalitis followed by dizziness, drowsiness, altered consciousness, and seizures, progressing to coma within 24 to 48 hours. Most people who survive acute encephalitis make a full recovery, but long-term neurologic conditions have been reported in survivors such as paralysis, seizures. Respiratory complications, such as breathlessness, atypical pneumonia is noticed. Patients with Nipah virus has high mortality rate of 40% to 75%. Let's discuss about the laboratory diagnosis of Nipah virus. Several clinical specimens such as nasal or throat swabs, cerebrospinal fluid, CSF, urine samples, blood samples, biopsy of brain and lungs can be taken for diagnosis. When the virus is focused on electron microscopes, virus particle appears in either spherical or thread-like in shape. Now let's discuss how the virus can be grown in laboratory. Nipah virus can be cultured in Vero E6 cells, human lung fibroblast cells, MRC5, and human neuronal cells, SKNMC. Growth of virus in these first resulting in syncytia formation with nuclei arranged around the periphery. Let's talk about the serological test. Serological tests are used to detect the IgM and IgG antibodies against G and N proteins of Nipah virus using enzyme-linked immunosorbent assay, ELISA. IgM antibodies are detectable during the first 5 days of symptomatic illness in more than 50% of patients. Similarly, when we talk about the molecular method of diagnosis of Nipah virus, F and G genes against the Nipah virus can be detected and amplified using reverse transcriptase polymerase chain reaction, RT-PCR. It is a highly sensitive and highly specific technique for rapid detection of the virus in the early stages of the infection. Let's talk about prevention of Nipah virus infection. Nipah virus infection can be reduced or prevented by implementation of the following method. These methods are: wash your hands regularly with soap and water. Avoid contact with flying fox bats or sick pigs. Avoid areas where bats roost and touching anything that could be soiled by bats. Avoid eating or drinking products that could be contaminated by bats, such as raw date palm sap, raw fruit, or fruit that is found on the ground. Avoid contact with the blood or body fluids of any person known to be infected with NIV. Throw away any fruit with bat bites or fruit that's touched the ground. Avoid contact with the saliva, blood or other bodily fluids of a person infected with Nipah virus. Let's discuss about the treatments of Nipah virus infection. There is no any specific drugs and vaccine against the Nipah virus. However, several drugs used for the treatment. Let's talk about treatment of Nipah virus infection. There are currently no drugs or vaccines specific for Nipah virus infection. However, ribavirin, remdesivir and favipiravir is under the clinical trial for treatment of patient with Nipah virus infection. Similarly, let's talk about the vaccine that can be used as post-prophylaxis against Nipah virus infection. Human monoclonal antibody, M102.4, used in serious patients with Nipah virus infection, which targets the ephrin B2 and ephrin B3 receptor binding domain of the henipavirus Nipah G glycoprotein, was evaluated in the ferret model as post-exposure prophylaxis. As we have mentioned that there is no any specific drugs and vaccine for the treatment of Nipah virus infection. But still we can do the management of patients based on the treatment of their symptoms. How can we manage the Nipah virus infection? By following ways. Administration of acetaminophen or ibuprofen in case of pyrexia, fever. Administration of antiemetics to control nausea or vomiting. Using inhalers or nebulizers to improve breathing difficulties. Taking anti-seizure medications such as levetiracetam, carbamazepine if you experience a seizure. Administration of monoclonal antibody of Nipah virus in serious patients. Intensive supportive care is recommended to treat severe respiratory and neurologic complications. Getting plenty of rest.